In Kansas, we have 9 juvenile detention centers across the whole state. And on average, we probably have about 250 to 300 youth every month who are in detention centers in our state. And what her data is showing us is that roughly 80% of youth who are coming into detention centers are identifying as having a need for mental health or substance use services. And so because of this money, detention centers across the state, such as the detention center here in Sedgwick County, are able to implement these services quickly for kids and families in our state. These grants are helping Kansas strengthen the juvenile justice system by giving youth and families the tools and the support that they need to build healthier futures and to get connected to services quickly in our state.
This grant is exciting because it offers the ability to leverage funds from the Kansas Department of Corrections to provide services in an area we've never served young people before in Sedgwick County. This grant allows us to offer assessments for kids on their admission to detention, and then if there's a need, we refer them on to our in-house providers who then do a further assessment and assign a level of care for services. Services actually do start here in the facility, and then there's a handoff once the young person is released back home to continue the services. This has really brought services to the forefront. Instead of waiting for the court system to finish, it allows the youth and family to be identified early and get started with their treatment to help hopefully curtail some of that behavior that we've seen. In this calendar year alone, from January 1st to September 4th, here in Sedgwick County, we've completed 426 assessments, and over 85% of those assessments resulted in a need for referral for treatment. That's something that we've always known in our gut, but this really helps shine a light on the need for these services in our community. So this legislation and this grant really allows us in Sedgwick County to help target the services needed by the youth and families in our city and our county.
So it's a really nice setup to where there's the therapy side, the kind of that clinical side, and then also the skill building and just kind of talking through things, working with that youth on whatever their individual needs might be. And then something that I think is extremely helpful is then that as they do go back into the community, we can follow them into the community. So we've established services, we've established a relationship, and then we can go in the community and continue those services.
From experience, just from looking at the numbers, about 85 to 90% of the assessments that we personally do here at the detention facility, they do qualify for some sort of a substance abuse treatment. So the impact that we create is beyond powerful. We can build a relationship, we can hopefully plant the seed, and by the time we do the groups, we do the individuals, how they hear, and when they released, we're gonna hopefully reintroduce them, bring them back to some direction, or if they go to a juvenile residential facility or even reporting center, we can continue with care to help them ease back into the community and hopefully one day to live a drug-free life.